The next section of orientation is going to be our environment of care. So EOC, so from here on out, I know we talked about, I'm not going to speak in acronyms, but for this one, anytime you, obviously now EOC is environment of care, okay? So our environment of care is really about ensuring the quality and the safety of the environment to achieve the best patient care. There are 7 EOC areas. We have safety, clinical equipment, utilities, fire, life safety, hazardous materials, security, and emergency preparedness. We're going to talk about each of these in a little bit of brief discussion around them. Okay. First one we're going to, back up when we talk about Environment of Care Committee. This is a multidisciplinary team as well. Folks from all over the hospital come together to really talk about our policies and procedures and any changes that need to be shared throughout the organization around any of those 7 EOC areas. Policies and procedures can also be found in each department because each of these areas, some of them are department specific when we talk about things like fire safety, emergency preparedness, those type of things are department specific, okay? So that's why there are policies and procedures and your manuals in each department, okay? So the first area we're going to talk about is safety. And what do you do if you have a safety issue? You're actually going to fill out a report in the Meditech system. We also have safety mentors that are in each department. They're actually frontline staff that are trained on how to fill out these incident reports in Meditech. And for those of you that are actually going to have access to Meditech, once you get in there, they'll train you on how to use them, okay? And again, the reports are found in Meditech. We also have a risk management department. Risk management really covers areas like they kind of manage and reduce preventable adverse events, as well as we get risk management involved when we have folks that say, you know, something happened at the hospital and I think I'm going to sue you guys. So risk management will get involved in those cases as well. But from the environment of care point, they look at things like any type of trending around maybe like falls or medication errors, those type of things. They will constantly watch those to make sure that we can manage or reduce any of these adverse events. Okay? All right. How to report an accident or injury of a patient or visitor. First and foremost, you want to make sure that the area is safe. Okay? If it's not, or the patient or visitor cannot be moved, you could call a rapid response. And do all of you have your badges today or not yet? No? Okay. On the back of your badges, there's going to be, you'll notice there's some information on there that's going to be pertinent to my discussion today. But on there, if in the event of coemergency, here in the hospital, you're going to dial 4333, and that's actually located on the back of your badge, okay? If your off-site location, of course, emergency is going to be 911. But back to the event that you have somebody that falls, or let's use an example of an injury of a fall. Patient falls in the lobby area. If the area is safe, that's great. First check. 2, does a rapid response need to be called? Do you need to call emergency folks to come to your area? If so, you would dial the 433, call a rapid response, and give your location, and folks will be at your area in short order. And then after that, you would be completing an incident report. And again, that's found in Meditech. And then you'd notify your supervisor of the incident. Okay? All right. What happens if there's an employee accident or injury? Same kind of process. With the exception of when you go into the incident reporting system, there's actually a report that's specific for employees, because then it then comes into a different realm of workers' comp, okay? So I used to be the former workers' comp coordinator. I have just since handed over that torch within the last few weeks. So I will tell you, because I can't take that hat off, that if you are injured while you are here, no matter how minor you think that it is, please make sure that you report it. Okay, I'll say again, no matter how minor you think it is, if you get a paper cut, I want to hear about it, okay? Or our workers' comp department wants to hear about it. If you're injured, no matter how minor you think it is. Now, for those of you that are shadowing, or if you're here in a volunteer basis, and you're not an actual employee of the hospital, you still report the injury, but it just goes through a different process. It doesn't necessarily go through our workers' comp process, because we can't provide workers' comp coverage for somebody that's not an employee. So you would go either through your preceptor at your school. If you're a student here, the volunteers, you would go through the volunteer office. Okay? Okay. All right. So, all right, think safety. This is just a quick little acronym when you think about safety. You know, stop, ask, fix or follow up, evaluate. Know that we're all part of the same team, and it is your job to make sure you think about safety first. Okay? We do have a confidential helpline, 4141. This is there if anybody, be it physicians, patients, staff, anybody, has any security concerns or safety concerns. You can call this line and leave a confidential voicemail. I do check that once a day. If it's urgent, if it's an emergency, you're obviously going to want to call 4333 as opposed to this number, because it's not something that I pick up and answer, because that way if somebody wants to leave an anonymous or confidential and not leave your name, you know, the caller ID would give it away if I picked it up when I answered it. So we just let it go to the voicemail, and then I check it every day if anybody has any concerns and they want to leave them on that number. Okay? All right, second area of environment of care is clinical equipment. Well, how do you know if it's clinical equipment? Here's the way in which to ask yourself, just kind of ask some of these simple questions. Does it support direct life? You know, is it power life, direct life support? Is it used for direct patient treatment or diagnostic information? Does it come in contact with patients? If you have yes to any of these, it's going to be considered medical equipment. Here's just some instructions on how you get medical equipment serviced. We have a biomed department. We actually have somebody who's contracted through UVM, and he's here on site. And so when you kind of go through Meditech to put in this request, you got to make sure you've got some basic information, the control number on the piece of equipment. Any clinical equipment is going to have a metal tab on it, and it's going to say, it's going to have the control number, any of the identifying information that's needed, it'll be on there. The big piece on medical equipment being serviced is you want to make sure you take that piece of the medical equipment out of the area, okay? Take it out of service, because what happens is this. If you see a piece of equipment like this with a broken, you know, piece of tape over it, says broken, what happens if that tape falls off and you still have it in a patient care area and somebody behind you, they're now getting ready to take care of their patient, and they go to get that pump and they don't realize that it's broken because that tape has fallen off. What do you think is going to happen? It potentially could put a patient at risk, okay? So make sure that you get it out of the area. I assure you there's not a repair ferry that's floating around this building looking for these pieces of equipment that have tape across them that say broken, okay? So you need to get it out of the area. If you're not able to, certainly you can call transport or the volunteer desk and they'll help you with that, okay? All right. What happens if it actually needs to be replaced? Again, you're going to contact the biomed. There are also numbers and pagers after hours. So, so for weekends and after hours, pardon me, this is how you contact them. Okay, how do you know if the equipment can be used? Let's say there's no broken sticker on it. You walk up to it, you say, well, how do I know I can use this? There are service stickers or labels on the equipment themselves. And it'll tell you if there is anything on, if any of those stickers on there are outdated, you have to assume you cannot use the piece of equipment, okay? If any of those stickers are outdated, because it could be something as simple as a battery change, or it could be something as significant as maybe like an annual overhaul. So you're not going to know. If there is a sticker on there that is outdated, do not use that piece of equipment, okay? And you go through the process of having somebody come in and replace it for you if you need a piece of equipment. All right. Third area is utilities. How do you know if it's a piece of utility? Again, you kind of ask yourself these questions. Does it power life support? Is it part of our HVAC, you know, which is heating, ventilation, and air conditioning, I think? Yeah, air conditioning. Does it control temperature, humidity, or lighting? Any of those? Is that utility? We have a lot of moving parts in this hospital, so, you know, you just kind of go through these questions. It'll kind of help you. There's also a list of them as well in your different areas in your environment of care manuals, okay? These are just some examples. Could be electrical, emergency, electrical power, plumbing, any of those. Again, you have a list in your EOC manuals. How do you report a failure? You're going to notify plant facilities. This is the way in which you do it. If you have a communication failure, you're going to notify information systems. What do you do if there's utility failure in your area? You need to have this in mind ahead of time, not wait for the failure, but know ahead of time, what do I do in the event something goes down? And there are department-specific contingency plans located in your emergency preparedness manual that you'll find in your areas, okay? All right. Fire safety, the fourth area, fire safety. You need to know some specifics around fire safety, know the closest location of your pull stations. In each of your areas, you'll find a fire evacuation plan. Know where that's at. It's going to tell you there's always 2 ways to evacuate an area. And then when you get into your department, you're going to know what are specific tasks you need to do based on your department. Like, for example, patient care areas, their fire plan is completely different than, say, us in administration. I know when I hear that fire alarm go off, we have to close all of our doors because it closes the smoke compartment in that area. Patient care areas are different. They probably have to close patient doors, but then there's other things that they have to do in the event that they're going to have to potentially evacuate a patient. Okay, so just know what those are prior to an event happening. Okay, so again, you would refer to your environment of care manual. All right, another thing I didn't cover, I apologize, on the fire safety is we have ABC extinguishers here at our hospital, and those are like all-purpose extinguishers, and then on an annual basis, you'll be shown how to use them, because the time that we want you to learn how to use them is not when there's a fire, but maybe potentially when everything is not so completely stressed out. So on an annual basis, you have an opportunity to use those. Okay? All right. How do you know if there's a fire? You're going to hear and see the alarms. There are boxes located all over the hospital. They're this strobe light, and it'll blink, and you're going to hear an audible alarm as well that will say code red. It's an automated system, so it's going to say code red, and it's going to give the location over the paging system of where the fire is. Okay? And then here's a nice little acronym to remember in the event that there is a fire. You're going to think about, and again, this will be located on the back of your badge. It's this RACE acronym, which stands for Rescue, Activate a Fire Alarm, Contain the Fire by Closing all of the doors, and Extinguish if possible, Evacuate if necessary. Okay? Now, it's not like when you were in school, when you hear the fire alarm, everybody goes outside to the playground, everybody goes outside to all of the fields to evacuate the entire building. Obviously, that is not a doable situation in a hospital. So the only time that an evacuation would occur is if the fire department determines that it's necessary, and then they will be the ones that will actually lead an evacuation and evacuate the areas that need be. More often than not, most fires in a hospital are located in the kitchen area, which of course is nowhere near our patient care areas, okay? So again, if you just remember this RACE acronym, and that will be located on the back of your badges. And a full evacuation can only be done by the fire department. Another acronym to remember, and this refers to our fire extinguishers, this is really how to operate a fire extinguisher, is this PASS acronym, which is pull the pin, aim the hose, squeeze the handles together, and sweep the base of the fire. Does anybody have any idea why we might sweep the base of the fire? Okay. Well, what happens if I just took my extinguisher and I hold it on that basket? It's on fire, and I'm just putting my extinguisher. I'm not sweeping.
Would you be putting it on the top and there could still be embers underneath?
Potentially, yep, yep. Another thing to think about instead of just hitting it right on the basket is if I hit it right on the basket, that basket potentially could shoot or spread. The fire's going to spread. By sweeping it, you're containing the fire. You're really taking like the oxygen and you're depleting it for the fire. So you're containing it by sweeping it. Okay, so just kind of keep that in mind when you're sweeping the base of the fire, as opposed to just hitting it dead on the fire. So acronym to remember, I will tell you when Joint Commission was here, I was with one of the nurse surveyors, and we went up onto the medical surgical floor, and she approached one of our nurses and was just kind of talking about environment of care stuff, and do you know where your fire extinguishers are? How do you know if there's a fire alarm? And do you know, what do you do in the event of a fire? So they want to know. That employee was able to take her badge. She said, hang on a second and I'll tell you. She flipped her badge over and she was able to recite the RACE acronym, which was very good. She knew the emergency number to call. So they will ask, aside from the fact, obviously we want you to know so that you're safe as possible and our patients are, but it's also a regulatory requirement that you need to know. It's important, okay? All right, evacuation basics. One of the things to keep in mind on evacuation basics, and the thing I point out on this slide, is if you hear the fire alarm going off, okay, do not use the elevators, okay? We encourage, obviously evacuation is happening, we're going to ask people to use the stairwell, but even if you just hear the alarm going off and we're not evacuating the building, let's just say you hear fire alarm, medical office building B, Basement area, okay, has nowhere near patient care areas, but so the hospital's still going about their business, and you see somebody getting into the elevator, I would encourage them to please use the stairwell until the fire alarm is clear, because the elevator could act as kind of like a chimney effect, if you will. And so if that fire is anywhere near that elevator shaft, you're potentially putting, they're putting themselves at risk by using the elevator, even though, we're not evacuating the building. Just always try to encourage folks to not use the elevator. Okay? All right. This is really just talking about a little bit about electrical safety. And one of the things to point out on this is a lot of times fires or smoke is due to faulty electrical appliances. So if you're going to bring anything here in the building, please make sure that it's a UL approved. So Biomed can take a look at that equipment and make sure that it's safe to use here. And most fires are due to somebody cooking popcorn in the microwave. So that said, just make sure if you bring anything in here to use, make sure that it's UL approved. Okay. All right, next area, hazardous materials. We have written and training programs around our hazardous materials. We have MSDSs. Does anybody know what an MSDS is?
Material safety data sheet.
Nice, nicely done. Okay. So what this does is this really is a chemical inventory. It gives you all of the pertinent information you're going to need to know about any chemical that we have here in the building. Now this also is department specific. Obviously the list of chemicals located in a lab are going to be much greater than maybe say the chemicals listed in one of our primary care practices. Safe to assume, right? So just keep in mind that's department specific. So we have an obligation to you to make sure that our MSDS sheets have all the pertinent information about what chemical you might be exposed to. In the event you're exposed, what do you need to do? So all of that is on those MSDS sheets. Okay? All right. And as I said, we have an obligation. It's also an OSHA requirement that we make sure we have all of that information on our MSDS sheets. Okay? All right. Basic components are pretty much already covered this, but chemical facts inventory includes updates, and all of that. So once you get into your areas, make sure that you're familiar of where that is located. So now, as well as our MSDS sheets, we also have written and training information around biohazardous material. And so Matt Tarr is our environmental specialist. So if you have any questions, he is the go-to guy. Okay. What do you do in the event that there's a chemical spill, okay, or a hazardous material spill? This is a nice little flow chart in which to kind of help you through that. Just kind of ask yourself some questions. Does it involve a fire? If yes, then you would use your RACE acronym. Are there injuries involved? If yes, are you going to respond appropriately and what you need to do? Does the spill have a chemotherapy agent or a radioactive agent? And again, this is just a nice little flow chart to kind of go through in the event that you have a spill. Okay? If there is a spill, a code orange would be called. That pertains to any hazardous material event, internal or external in nature. Typically, we find these to be external in nature. For example, we had one recently, I think it was last summer at Spalding High School, where the one of their chemistry rooms had I think a chemical spill in one of the closets, so there were several employees that were exposed. So a code orange, an external code orange was called. Those patients were brought to our emergency room, so we had our hazmat tent set up outside, and they kind of had to go through that process first. So that would be an example of a hazardous material event or chemical spill where a code orange was called. Okay? All right, we do have a patient safety officer, although this indicates that it's Barb Sharp. She has since retired, and so I'll have to update this slide. But we do have a safety officer in the event that a chemical exposure happens. And again, you read your MSDS sheets, but I'm going to kind of cover what happens in an event of an exposure in a moment. All right, hazardous waste. We have different types of waste that we generate here at the hospital. And how do you identify them? There are some simple ways here through our bags that we use. So red bags are regulated medical waste. This covers anything that is soaked or dripping in blood or body fluids. And typically they say if it's like over 100 cc's. Now, obviously I don't expect that all of you are going to measure it. The bottom line is this: if it's dripping or soaked in blood or body fluids, then it's considered regulated medical waste. And the reason I kind of point this out is because you have to differentiate. We don't want to see, for example, you know, tissues in there, because it's very, very expensive to dispose of regulated medical waste. It's like 40 times more expensive than non-regulated. So you want to make sure that you're putting the appropriate items in those containers. Chemotherapy is also a regulated waste, very expensive to dispose of. Again, make sure that it needs to be in there if it's chemotherapy waste. We have black bags, which are used for like our general waste, and anything like maybe contaminated with urine or fecal matter, that kind of thing. Food or related items. We also have sharps containers for like our needles and syringes, scalpel blades, that kind of thing. And then we also recycle here, so we have blue containers located all over the hospital for recycling. You can commingle, so all of recycling can go in there. We also compost here as well, so if you have any food waste in the kitchen area, that goes into our compost, so there's no need to throw that away. We do have a pretty heavy-duty recycling program here, so we encourage you to please recycle. All right, labeling. Biohazardous material is going to have this infamous biohazardous label on it. Again, those are red bags, containers. They have that label. And then there's also biohazard containers that are, you'll see around the organization. So if your area has those, just be familiar with them, okay? Bloodborne pathogen. You are potentially going to be exposed to a bloodborne pathogen because you have an occupational exposure due to the fact you're around human blood and body fluids, so potentially you are going to be exposed. So you just need to know, what do you need to do in the event of an exposure. So just a little bit of background. What is a pathogen? It's a disease-causing microorganism, okay? Some pathogens of concern in our area would be like hepatitis B, hepatitis C, or HIV, okay? And most often, the most typical exposure is going to be indirect, like person to object, like a needle stick, okay? So that's going to be potentially your greatest risk, is going to be person to object. So just please, if you're in direct patient care, be very careful at what you're, if you are in the event that you're near a patient and you have a needle, please make sure that you're just careful with it and know that you're potentially going to be exposed, okay? And safety is going to be first. You're going to use your personal protective equipment as you're doing any of those procedures, okay? Hepatitis B. You will receive a vaccine through the employee health nurse. It is free of charge for you. I believe it's, as it says here, it's a series of 3 shots. So she'll be discussing that with you when you go over to see her later today. Okay. Bloodborne pathogen, if you have any information about it, we do have an infection control nurse, and we have an environmental specialist that can discuss any of your concerns with you. Also your supervisor as well, if you need any information. Okay. We do have a control plan, exposure control plan, and really what this does is it's a way in which we can kind of discuss the risk of exposure, what you need to do, and that kind of thing, and that is located on your route on the shared drive in your infection control manual. The control plan covers things like personal protective equipment, your job task list, because in some areas, as I said, it's department specific. All right, thank you for that, I appreciate it. All right, another area, environment of care area, is security. So really, security affects everyone in this building. And so one of the big things that you really need to know is where your ID badge is. There's a reason why we have them. Park in your designated areas, and really know security around for your facility. And we'll talk a little bit about infant abduction, aggressive behavior, and emergency management. But one of the big things that I like to point out on this is about the wearing of the badges, because we have lots of folks that come in and out of our hospital. And also, as you notice, there are folks out in the parking lot working on the pavement. We have contractors that are in here. If there are people that are here working in our building, although they're not an employee, they still need to sign in. So if you're coming through the employee entrance and you see somebody come in that doesn't have a badge, don't be shy about asking them, can I bring you up to the area so you can sign in? Maybe you see somebody walking in with a bunch of tools, so it's evident that they're a contractor and they're just doing some work here for us. Make sure that they sign in, and the reason that is because there are areas in the hospital that you can only get in and out of via a badge, with a badge. And so one of those are the employee entrances and exits. And so make sure that if you are coming in and you see somebody that's coming in through that entrance that doesn't have a badge, please make sure you just kind of, I'd be more than happy to bring you up to the front desk so you can sign in, because we need to know who's in our building. If we're in the event that we're trying to do an evacuation and we don't know who's here, I mean, obviously there are visitors that come in through the main lobby, but if we got folks that are working in different areas here, we need to know. We've got to, we've got to let them know. If we've got somebody who's working in the generator room, if they just come in and bring themselves to the generator room, that potentially could be a problem. Okay? All right. Employees are responsible for timely reporting of security incidents, like say if you've lost or somebody has stolen something from you, if you've witnessed aggressive behavior, if the property has been damaged, any of these items, you're responsible for reporting them, and you can do a security incident report. I've already really covered the area about the badge. One of the things I also want to point about badge access is this. There are certain areas within our organization, like the emergency room, the Davis Special Care Unit, which is our intensive care unit, and Women's and Children's, and our inpatient psychiatry. Those are areas that are badge access. Inpatient psychiatry is actually, you have to have a key. So this one isn't so much of an issue because you can't get in there unless you work there. But Women's and Children's, intensive care unit, and the emergency room, you can get in and out with your badge. I encourage you to, if you are working, let's say you're working here that day, and you hear of a friend who's coming in to have a baby, and they have their baby in there in Women's and Children's, if you are going to visit that patient, and it is not in the course of your line of duty that day or your job, please make sure that you do the same thing that any other visitor would have to do to get into that unit. In other words, you'd have to buzz to say, can I come in and visit? Emergency room, same thing. Please don't go in through the back entrance if you hear that somebody that you know is in the emergency room. You would go through just like everybody else through the main area and be buzzed in. Again, it's so that we know who are in these areas, particularly Women's and Children's. We had a bit of an issue where some staff were going in and out of, and they had actually been in other patient areas, now potentially bringing in on their scrubs or on their person, bringing in that in, and which would potentially affect the babies and new babies and moms. And so we really need to be careful of that. So don't let yourself in unless you're there because it's part of your job. Okay, just respect those areas. And there's a method to our madness, and it's because, again, realizing the safety behind it, we want to make sure that we're not putting our patients at risk. Same thing with Davis Special Care. There's a buzzer to get in if you're going there in the capacity as a visitor. Okay, make sense? Thank you. All right, weapons policy. You can't have them here. That's really the bottom line. No patient, visitor, employee is going to be permitted to carry a weapon on campus at any time. Okay? We do have security here 24/7. We also have Berlin Police, and they're located in our emergency room. I believe their hours are like 7 to 3 a.m. or something like that. So they're located in the emergency room. And so those are the only people that are able to have a, not our security because they don't carry weapons, but the police, the Berlin Police, are located in the emergency room. Okay. Let's talk about an armed intruder or a hostage situation. Either of these you would call a code silver, and then you kind of go through this procedure. So if you're on site, you'd call 4333. If you're off site, 911. Again, those are emergency numbers. You're going to give the operator as much information as you have. They're going to contact 911. And then one of the things I want you to keep, so they'll announce the code silver, but one of the things I want you to keep in mind is about this seek a secure area and nest. Again, this is both for armed intruder or a hostage situation. And so the NEST acronym is a neat thing to kind of just remember. Okay, so the first and foremost is you're going to not fail to react. So the N stands for not nothing. You're going to evacuate. So if it's safe, evacuate and help others. If possible, then you're going to shelter in place. If you can't evacuate, you're going to shelter in place. So you're going to secure the area, stay quiet and low, silence phones and equipment. And the last resort is going to be to take action. So again, this is this NEST acronym. And so only if you're in imminent danger are you going to take action, okay? That's for an armed intruder or a hostage situation, code silver, okay? What happens in the event that you have aggressive behavior or you feel you're in a potentially dangerous situation? A code green can be called. And so you'd hear a code green, you'd call 4333 if you need to be the one to call the code green. You'll hear it announced overhead, code green, it'll give the location. Once a code green is called, you will probably have about 30 staff that'll come to your location in pretty quick time. I mean, they'll be there very, very quickly. So if you feel you are in imminent danger and you need help, you can call a code green. Anybody can call a code green. It doesn't have to just be a manager. It's anybody who feels they are in imminent danger can call a code green. Okay? Hostage situation with a weapon. Again, call 4333, the 911 if you're off-site. You know, there's a hostage situation, give your location. And again, you'd use that NEST acronym. Okay? Code Amber. This is done in the event that there's an infant or child abduction. And once you get your badges, you're going to see all of these codes with all these various colors on your badges. For example, code red is on here, which means a fire. Code white is on here, which is a disaster, be it internal, external. We'll talk about that in a minute. Code green, violent behavior. Code blue means a patient is having a cardiac arrest or somebody on site is in cardiac arrest. Code amber is what we're covering now. Code black, which talks about a bomb threat. Code orange, which is a hazardous material or chemical spill. And code silver is an armed intruder, okay, or hostage situation. So these are located all on they'll be on the back of your badge. So once you get those, please feel free to familiarize yourself with those. So back to the code amber. If a code amber is called, they'll say code amber and then the age of the child. So for example, code amber 5, which means that we're looking for a 5-year-old. Once you get into your departments and you look at your environment of care manual, it's going to tell you specifically what your department's responsibility is for that particular code. In the event of a code amber, all of the entrances and exits are covered by two staff. So immediately everybody disperses to their appropriate exits. And then the process begins around a code amber where we have to search people, we have to look in their bags, because that baby or child could be a 5-year-old, obviously different situation, but if it's a baby, you'd be looking at all of their belongings. Typically, abductors are women. Like 95% of the abductors are women. That's an interesting statistic when you think about it. Could be some little old grandmother, but about 95% of them are going to be women. Okay? All right. Emergency preparedness is our last EOC area. So when you ask yourself a question, what is a disaster? Here's some examples, but one quick and easy way to kind of answer this question for you, it's anything that affects day-to-day patient care. So anything that's going to affect day-to-day patient care. We had an example where we had at one of our practices, we had an internal disaster where it was code white because a family of skunks had decided to take up residency under one of the porches that I think it was in Waterbury, but way back when. So they had to close the practice. So a code white was called because it affected the day-to-day patient care. They had to reroute all the patients. It was just a mess. You know, an external in nature could be something as significant as an auto accident on the interstate. Lots of folks are going to be coming here. We're going to have lots of patients coming into our emergency room. A code white would be called at that point in time. Okay? Your disaster plan is kept in your emergency preparedness manual, which is located on the route, and then there are department-specific responsibilities. So if a code white is called, it's going to be announced overhead page. Emergency pagers will be then notified. There's a fan call list in each of your areas. That'll go into effect. You may be called in from home. Runners may be needed if communication is affected. So the bottom line is our command centers are always set up, in conference room number 3. So to people from all of these areas report to conference room number 3. All right. However, that said, if a code white is announced, unless you know specifically that you're the one that's supposed to report to conference room 3, you're going to go back to your immediate supervisor and wait for instructions. The reason for that is, the rationale behind that is, can you imagine if everybody descends upon conference room 3, we're going to have yet to call another code white because now we're going to have an internal in the lobby area. So just wait, report back to your immediate supervisor and wait for instructions. Okay, on what you need to do once a code white is called. Once a code white is over, it's deactivated. You're going to hear code white, all clear, and that'll be announced 3 times. Again, code white, all clear, announced 3 times. All right, what do you do in the event that there's a bomb threat? Some of the things to keep in mind, again, is just be calm and courteous as best you can. Listen attentively for voice characteristics. Don't interrupt the caller. As soon as you're able, you're going to call 4333. And you'll call for a code black, and you'll give as much information as you can. A code black is going to be announced overhead. Overhead page again. Emergency pagers will be activated. Fan call list, runners, same thing. Command center will be set up. And then these next few slides, I'm not going to go over them. You have them with your packets. Really talk about if a bomb threat has occurred, about searching. The decision to evacuate is going to be done by the incident commander after consultation with the police department. So it's not something we would just do willy-nilly. We would have to determine, is it necessary to evacuate? This just talks about search teams. Once a code black is announced, you want to make sure, one of the big things to keep in mind about using two-way radios, cell phones, that kind of thing, you want to not use them because potentially that could put a little bit of a spark if there's a bomb in your area. These are just things to kind of keep in mind. Search techniques, if you are asked to search an area, this just kind of goes over. It's always a two-person search team. Never go in an area by yourself. And then again, searching areas. I'm not going to belabor this. You can look at this at your leisure. Okay? And lastly, once a code black is over, it's deactivated. When you hear a code black, all clear, again, that'll be announced 3 times, just like the code white. And you'll be all set. So any questions on any of this? Were you able to find everything that you needed for your quiz? You were looking like you're about ready to have a question. You're all set? You good?
No, yeah.
Perfect. All right.
Well, good morning. My name is Wilma Duke. I work in human resources. I work primarily with the benefits. And the first thing I'm going to do this morning before we jump into talking about our flexible benefits plan is just give you some information about our retirement plan here. CVMC provides a 403B retirement plan. It's similar to a 401K, but because we're a nonprofit organization, it's called a 403B, and that's how you'll come to hear it referred to. The booklets are pretty self-explanatory. They talk about the automatic enrollment feature, and that's probably the most important thing you need to know. If you do not make a phone call or go online to enroll in this plan, you will be automatically enrolled. If you don't want to be automatically enrolled at 1% salary deferral, then you do need to make sure you go online or call them to opt out of the plan. Every employee, even per diem employees, are eligible to participate in this plan. You will have an opportunity to make salary deferrals. It's all your own money going into the plan initially. Once you've met eligibility, which means once you've completed 1,000 hours in your first employment year, you'll become eligible for an employer-based contribution, which is currently 3%, and CVMC is also doing a matching contribution of up to 3%. So just important to know that, initially when you sign on, it's all your own money going into the plan. After you meet eligibility, if you meet eligibility, you'll be eligible for employer contributions as well, okay? And the booklet explains everything to you about the automatic enrollment. It explains to you how to go online or make a phone call to participate. Talks about the vesting, the contributions, how they're allocated based on, your particular choices that you make. So I just want to make sure you folks have that information. If you have any questions, please feel free to call me. My phone number is provided in your benefit packets. For those of you who are not eligible for the Flex Benefits Plan, you might not have my information, but you can certainly contact me in Human Resources, okay? You will not be able to contact the group Diversified or Transamerica, which is the retirement plan administrators. You won't be able to contact them until after you've received your first paycheck, because that's the way that the information about you gets loaded into the system, and that's how they'll be able to identify you as a new participant, okay, is when the payroll file is transferred to them. So just hold off until you receive your first paycheck before you try to enroll or make any changes with this plan, okay? So the next thing, now that we've talked about the 403B plan, we're going to talk about the Flex Benefits Plan. And those of you who are eligible for our Flex Benefits Plan have been provided a packet that includes an instruction letter, a workbook, and some various materials about the individual plans. the packet of information is probably very detailed and a lot more information than what we're going to go through on the slides. But the slides will provide you with a brief overview. I'm also available to meet with folks individually if you have specific benefit questions that you want to talk about, or if this is your first time having any benefit programs available to you, or if you just feel that you're not comfortable doing an online enrollment. I'm happy to sit down with you and help you with that. The instruction letter in your packet explains how you go online to do this enrollment, okay? And similar to what I just explained about the 403B plan, our third-party administrator, Crosby Benefit Systems, needs to have information about you in their system before you can perform your online open enrollment, okay? So give it about 10 days, okay? They have a 10-day service agreement with us. They're usually faster than that. I would expect that you could go online and do your benefit enrollment by Friday, but you certainly won't be able to sign on later today or tomorrow to do that, okay? So look your materials over and kind of get a feel for, what the benefits are all about before you sit down to do your enrollment online, okay? Those of you who are being hired today will become eligible for benefits the 1st of September. You do need to satisfy 1 month of employment, and then benefits take effect the 1st of the following month. So September 1st is your benefit effective date. Okay? And I'll just get started going through the slides. If you do have specific questions and you want to interrupt me, feel free. Or as I said, if you really feel that you have specific questions you'd like to discuss with me one-on-one, we can set up time to do that later on. So our Flex Benefit Program is provided to full-time and part-time employees who are scheduled to work at least 40 hours per pay period. This is a Section 125 cafeteria plan. The contributions you make for your benefits are pre-tax contributions. The plan includes options for medical, dental, vision, disability insurance, life insurance, and spending accounts. You become eligible the 1st of the month following 1 full month of employment at 40 hours or more bi-weekly. Your benefits can be changed during open enrollment or at the time of an IRS recognized status change. Deductions are withheld 26 times per year, and we do provide online enrollment. Now, a piece of information about this open enrollment: our fiscal year runs October 1st to September 30th. We operate on a fiscal year basis. So our open enrollment is coming right up. In mid-August, we'll be distributing enrollment packets to all of our employees. You folks will get a packet as well, okay? Although you're selecting benefits now that will be effective September 1st, you'll also want to participate in our open enrollment for your benefit renewal that will occur on October 1st, okay? We're not making any changes to plans, and if you don't go online and do an open enrollment after your initial enrollment, your benefits will still continue for those benefits that are allowed to be renewed like that. One thing, if you take out a medical spending account or a dependent care spending account, you'll want to be sure to go online and carry that over, because it won't carry over automatically. Your choices for medical, dental, vision, life insurances, those things would continue, and we're not making any changes with any carriers this year, so there's not going to be a great deal of change occurring during open enrollment. Okay? The IRS recognized status change just means that once you've made your benefit choices, they remain in effect for the entire fiscal year unless you have a qualifying event, such as, if you had a change from part-time to full-time or something like that that was work-related, I would be notifying you and letting you know that it was an opportunity to make changes to your benefits. If you have a qualifying event that's a life event, like if you got married, got divorced, if your spouse changed jobs, and that affected your benefits in some way, you'd want to contact me within 30 days of the event so that we could make changes to your benefit choices, okay, that are recognized by the IRS as a qualifying event. And deductions, as I said, are withheld 26 times per year, and we do provide online enrollment. The options for the medical insurance are either an HMO or a PPO plan. Both plans are provided by Blue Cross Blue Shield, and both plans include options for hospital services, physician services, and prescription drug coverage. We do have some additional benefits that we call in-house benefits, such as filling your prescriptions at our in-house pharmacy. The Blue Cross Blue Shield plans have a $100 deductible, but if you use our in-house pharmacy, there's no deductible on the prescription side, so that does save you that $100. Our co-pays for the 30-day supply of medications is also less than the standard retail pharmacy cost through Blue Cross, so it's another benefit to using our in-house pharmacy. On the PPO plan, that's the additional in-house benefit, okay, is the pharmacy. If you choose an HMO plan, you have some additional benefits provided through CVMC, such as a reduced copay. If you have an inpatient hospital admission, the copay is reduced by 50%. If you have an outpatient surgical procedure, the outpatient copayment is completely waived. So it doesn't cost you a $500 copay for an outpatient surgery. That would be on any services provided here at CVMC, okay? And some additional savings on rehabilitation and cardiac rehab. You would pay a $25 copayment initially, and then all the subsequent visits, the copay would be waived. So again, that's typically either a $25 or a $40 copay for each visit. So that's a significant savings for using CVMC facilities whenever you can. CVMC also pays 74% of the premium cost for part-time employees and 80% of the premium for full-time employees. We do extend coverage to civil union marriage and domestic partners who meet certain criteria, and we do provide an opt-out incentive for those employees who provide proof of other coverage. You'll find this opt-out waiver form in your packet. It's a paper form. When you go online, you will be waiving the benefit. You'll be checking the box to waive the benefit, but you'll also need to complete that paper form, make a photocopy of your other insurance card and attach it and send it to Human Resources. We don't have a method for you to complete the waiver online, okay? So that's one additional piece if you're not going to be taking our medical insurance. The opt-out incentive is explained on the waiver form. It tells you the amount that you receive, whether you're full-time or part-time, and whether you're taking a single plan, a two-person plan, or a family plan. We do offer medical independent care spending accounts, and deductions are made on a pre-tax basis to reimburse your out-of-pocket medical expenses and daycare expenses. They call it dependent care expenses. It's a little confusing to some people, but it's really eligible child care expenses. Your claims must be incurred during the plan year, and unused account balances are forfeited. So again, just keep in mind that this is on the, for the medical reimbursement, it's not an HSA. It's not, we don't have a high deductible health plan, so it's not a healthcare savings account. It's a reimbursement type flexible spending account where the claims have to be incurred during the plan year, and then you need to submit and receive your reimbursements before the end of the fiscal year period or the run-out period, which for our plan is December 31st, okay? You'd have to have all your claims in. Another little note for you folks who are coming in at this point, it would be wise to really think about enrolling in a medical spending account at open enrollment, which is the October 1st renewal date, versus September 1st, because if you're electing a medical or dependent care spending account for September 1st, you're really only electing what you will spend in that 1 month, the month of September. So you might want to hold off until the open enrollment piece before you enroll in one of those accounts. Okay? The dental insurance is provided by Northeast Delta Dental. It's a $50 deductible for a single plan, $150 deductible for a family plan, 100% coverage for preventative care, and they do allow up to 4 cleanings per year. Basic restorative work is covered at 80% after the deductible. Major restorative and orthodontia is covered at 50% after the deductible and waiting periods. The plan has a $1,500 maximum per person per calendar year and a separate $1,500 lifetime limit on orthodontics. CVMC pays 50% of the premium for part-time employees, and they pay 65% of the premium cost for full-time employees. I know the slide says 60%, but we just upped that this year, and it is a 65% CVMC contribution. Keep in mind that the dental insurance does run calendar year, even though we operate on a fiscal year basis. When they talk about deductibles and plan year maximums, they're always talking about the calendar year. Okay? So if you meet your deductible in September, you're not going to have to meet it again starting in October. You won't have to meet it again until January. Okay? We also offer a plan called Vision Service Plan. This is a comprehensive vision plan that provides not only an exam but also glasses or contact lenses. You can get an exam and lenses covered annually. You can get a frame covered every other year, subject to the plan maximum, which currently the frame maximum is $140 allowance. The copay for an exam is $10 and copay on the materials is $25, and we also have some additional discounts that are available through the participating providers. Vision Service Plan does require that you use participating providers to get the best level of benefit, and you can find a list of those providers online. I'm not sure if it's in your packet because it has become quite an extensive list, takes up a lot of room in the packet, but it's available at Vision Service Plan online or on our intranet or our route directory. Keep in mind that on your medical insurance, you do have an annual eye exam, but it's just the eye exam. So if you have a Blue Cross plan, you can get an eye exam, but it won't cover anything for glasses. And for those folks who want the extra, more comprehensive plan, the Vision Service Plan is a way to do that. So we've talked about the medical, dental, vision, and spending accounts. We're going to shift gears a little bit now, and we're going to talk about disability, and the next slide is going to be the life insurance. CVMC considers disability insurance at the long-term disability level to be a core benefit, and CVMC does provide you with a credit equal to the cost of the standard long-term disability benefit, which is a 60% income replacement 180-day waiting period option. Okay, you'll receive a credit equal to the cost of that. So in that sense, there's no cost to you to have that insurance. Okay. The long-term disability options are a 90-day, 180-day, or 210-day plan. And you can choose any one of those three plans as long as you do elect one of them. The hospital pays for the core benefit, which is again the 60% 180-day option. If you choose to take a 90-day 60% income replacement, then you will have to contribute a little bit to the cost. If you take a 40% 210-day elimination period, you'll be spending less than your credit, and you'll have a little credit money left over to offset another benefit cost. Okay? The long-term disability insurance is designed to be protection against catastrophic type disability because it does have a substantial waiting period. It is considered a core benefit, and you are required to enroll in one of the options. Your coverage cannot overlap with short-term disability, so if you find that long-term disability doesn't meet all of your disability needs and you're going to choose to purchase a short-term disability plan, just be sure that you're not buying a long-term disability plan that overlaps, okay? Short-term disability insurance is available to you. It is not considered a core benefit, but certainly a valuable benefit to a lot of employees who really want to have a more immediate income replacement. The waiting period for short-term disability is 1 week of disability, and then short-term disability benefits will continue for up to 26 weeks provided you remain disabled for that entire time. And you have your choice of either a 50% or a 70% income replacement policy capped at $2,000 weekly. You will find the short-term disability options online, and it will tell you the exact amount of coverage that you're eligible for and the specific premium cost. The same with the long-term disability. You'll find the premium cost online because those benefit premiums are directly related to the volume of benefit provided, so they're not a flat premium cost. Okay? Life insurance is another core benefit, and CVMC provides you with a credit equal to the cost of a 100% employer-paid basic term life policy equal to 1.5 times your annual base salary. This coverage is voluntary, so you're not required to enroll in it, even though you are provided a credit equal to the cost of the basic policy. If you choose to take advantage of the basic policy, you're then eligible to buy additional amounts of life insurance up to 3 times your annual salary. And this is term life insurance. Should you enroll in the basic term life insurance, you're eligible not only to buy additional life insurance on your own life, but you're eligible to buy dependent life insurance on your spouse and or your children. Life insurance coverage over $50,000 is taxable, and because it's offered on a flex plan, we just need to make you aware of that, that if you're choosing a life insurance benefit that exceeds $50,000, there will be a small amount of imputed income tax that will be adjusted at the end of the year. It's not a significant amount of tax for folks who are buying, typical amounts of life insurance, so it's certainly not a reason to choose not to buy the life insurance, but it does need to be disclosed to you. Keep in mind that since the life insurance is a voluntary benefit, there is something called guaranteed issue, and if you enroll in the life insurance at your first enrollment opportunity, which is now, the life insurance benefit is a guaranteed issue benefit, meaning that there's no health questionnaire, there's no physical that's going to be required or anything like that. It's guaranteed to be issued. If you decline the life insurance and want to buy it later, even if it's at an open enrollment period, you would have to satisfy what's called evidence of insurability. You would have to answer health questions, and you may have to submit to a physical examination. So I usually tell folks, if you're uncertain about whether or not to take the life insurance, it's easier to take it now and drop it at a subsequent open enrollment than it is to pass it up now and then try to get it later, because sometimes you can be declined for life insurance. Some additional benefits that are available through CVMC are we do have an on-site credit union. We offer discount home and auto insurance through payroll deduction. We offer over-the-counter medications through a vending machine system, long-term care insurance, Vermont Higher Education Investment Plan, some fitness center discounts, tire store discounts, jury duty and funeral leave pay. We offer pet insurance, AFLAC, and of course the shift float call and unscheduled shift differentials. And the shift float call and unscheduled shift differentials are administered at your department level. So if you have questions about those, it's best to seek out your department manager and ask questions, because those do vary based on whether or not you work in a clinical area, and what is considered an unscheduled shift in one area might be different in another area. We offer an EAP program. It's called an Employee Assistance Program. It's available to all employees and their family members who reside in the household. Free short-term confidential counseling information and resources. This is just an example of some of the things that the EAP program assists with. We do have an EAP representative who comes on site, and I believe that she's here at least once a month to meet with employees. However, you do not need to wait for the EAP person to be on site. Employees can make contact with the EAP at any time on their own. The pamphlets are handed out in your packets. I know that they're available throughout the hospital as well. And this, again, is a completely free and very confidential employee assistance program. Combined time off, or CTO time, is available to full-time and part-time employees. It's used for vacation time, sick time, personal days, and holidays. At the full-time level, you will initially accrue 26 days off annually. After you've been here 5 years, in your 5th through 10th year, you will accrue an additional 5 days, bringing your total annual accrual to 31 days. And after 10 years, 1 additional day, 32 days. And finally, after 14 years, or if you're a department head or physician, you'll accrue at the highest level, which is 36 days annually. Part-time employees accrue prorated based on the number of hours you actually work. So, that means if you're a half-time employee working 40 hours, you will accrue 4 hours of paid time off each pay period instead of 8 hours. But you will accrue CTO time on additional days that you might be asked to work. So even though you may be hired into a 40-hour biweekly position, if you're asked to pick up an extra shift and you end up working a little more than your 40 hours, you will accrue CTO time on all the hours you work, up to 80. You're allowed to accrue up to 2 times your annual accrual rate and hold it in what's called your CTO bank. And you may also cash in CTO or use it toward your benefits annually. You also may donate CTO under our CTO donation program, which is for employees who may have exhausted all of their own CTO due to some catastrophic event. Usually it's a very serious medical condition or something like that, and employees can choose to donate hours to that coworker who's used up all of their own CTO time. The cash-in or using toward benefits. Using your CTO toward benefits is really helpful if you want to reduce your overall benefit cost, but the drawback is that you will accrue less time off. So I encourage people to talk with me about that and really understand it before you make the leap to enroll in a CTO contribution toward benefits. The cash-in is used after you've accumulated quite a bank of CTO time. So again, not typically something that new employees would be doing because you wouldn't have accumulated enough CTO to take advantage of that at this open enrollment. But it is offered during open enrollment, and we have twice a year that we allow the cash-in to be done. However, it does need to be pre-elected during the open enrollment season. Okay? And that concludes our Flex benefit presentation.